Today, we'll discuss a very important concept called ectopic pregnancy. So, the pregnancy, let me show you the diagram of the uterus. This is the uterus, this is the cervix. These are the tubes that run on both the sides of the uterus towards the ovaries. So, if you have gone through my video on fertilization, you would know that the egg which is released from this ovary and is traveling towards the uterus gets fertilized in the tube, the fallopian tube. And the fertilized egg then travels towards the uterus and lodges in the upper part of the uterus. Now, in case of an ectopic pregnancy, what happens is this fertilized egg does not travel all the way to the uterus to reach its destination here. Rather, it gets stuck here, or sometimes it starts traveling in a reverse direction, lodges somewhere in the tube here, or even comes out all the way from the tube and lodges somewhere on the ovary or in the abdomen. Or sometimes the egg does reach the uterus but then slides lower down and reaches the lower segment, lodges here or even in the cervix. So, if the fertilized egg does not lodge at its proper place in the upper part of the uterus, it is called an ectopic pregnancy. This is very serious. Let me explain why. As we all know, uterus is a muscular organ designed to hold the pregnancy. So, when the baby is growing, the uterus can accommodate this pregnancy and grow along with the baby. It stretches as it is a muscular organ, and so it can accommodate almost a 3 kg of baby within it. However, the tubes and other organs are not designed that way, and so when the baby grows, this tube would just tear and burst off. Or even in the lower segment, it would not be able to stretch that much, and so will not be able to support the pregnancy. That would result in torrential bleeding. Sometimes it becomes life-threatening too. And so, ectopic pregnancy is a serious concern. So, once you miss your period, within 15 days of missing your period, one should get a sonography done to check whether that pregnancy has reached its place in the uterus. That is the first sonography which we do to confirm the pregnancy and to confirm whether the uterus has the pregnancy at its proper place or not. That is the very important part of the first sonography that is done during your pregnancy. Thank you.